Hello everyone, my name is Madison. I'm trying really hard not to faint right now. So before I go on, I must respectfully acknowledge the unceded territories of the Songhees, Wasanich, and Esquimalt peoples whose lands we are gathered upon. And I have been a grateful but uninvited visitor for the past 4 years. I was lucky to complete my practicum at the Center for Indigenous Research and Community-Led Engagement at UVic here with the Aboriginal HIV and AIDS Community-Based Research Collaborative Center, also known as the AHA Center. My role primarily involved supporting the AHA Center and its Weaving Our Wisdom study using a land-based approach to optimize holistic health among Indigenous people living with HIV, also known as the WOW study. So my supervisor and her colleagues identified challenges faced when trying to recruit Indigenous community study collaborators due to widespread mistrust of researchers and Western and colonial research practices, and a bit of unfamiliarity with Indigenous and community-led research methods. So I was asked to help address this by creating a set of informative fact sheets that were founded in Indigenous knowledge and worldviews that aimed to describe community-based research, or CBR, and affirm potential participants' inherent expertise for doing it. I also wrote the verbal and written consent forms for the study and the ethics application using the same criteria. And those tasks comprise my practice scenario. This is an example of the first fact sheet I created. So of the public health and social policy skills and values, these were the most critical in addressing my practice scenario. In creating documents that will have diverse audiences, I used interprofessional, multicultural collaboration and teamwork to try to make sure my work was informed by and representative of diverse perspectives. To select and create content, I used critical and creative thinking to integrate evidence-based literature in describing community-based research and also justifying the WOW study to potential participants in the consent forms in a way cognizant of diverse audience literacies, but while still satisfying research ethics board standards. Cultural safety and competence were, of course, particularly important. I practiced self-reflection on my own sociocultural location and identity, and familiarized myself with some cultural characteristics of the intended audience of Indigenous people living with HIV. This was intended to make sure I didn't overburden my colleagues with educating me on these things while still seeking their input on the degree of cultural safety and accurate representation in my writing. The center was the value for Indigenous knowledge and the right to self-determination, which guided all of my work. I'd also like to share some of my key insights. This quote here was shared during a National Aboriginal Research Advisory Committee meeting I attended, and it really stuck with me. While the Truth and Reconciliation Commission's report and calls to action are incredibly comprehensive, research is only mentioned 4 times in the context of funding more research on residential school experiences. Throughout my practicum, it became really clear that research is, of course, imperative for reconciliation, but also important for resurgence and integrating Indigenous ways of knowing, being, and doing, as Action 22 calls for. So yes, research has great capacity to kind of highlight the evidence base for reconciliatory actions, but it also, like Indigenous-led and community-based research, has the capacity to collect and tell stories of Indigenous resilience, community assets, land stewardship, healing and wellness practices, the list goes on and on, all of which is really important truths that need to be highlighted for moving forward in a good way towards multiculturally integrated health and community care systems. Additionally, done well, Indigenous-led land and community-based research can be healing in and of itself, as it's been shown to increase cultural connection, positive social relationships, long-term mental and physical health, self-confidence, knowledge of and connection to the land, and it's also a really good setting, effective setting for, training non-Indigenous workers and increased cultural awareness. That said, I think Action 22 also applies to those of us in health and community service research contexts. Sorry. Yeah. Okay, sorry. Yeah.
Okay, well, maybe we can have some questions for Madison.
Thank you, sorry.
About her highlights in the BA program.
No, my last sentence of that last slide.
Yeah.
Yeah. While people are thinking, maybe I'll thank my supervisor, Sherry, and my turned into co-supervisor, Andrea, and the instructors and administrators, and special thank you to Natalie for getting us all this far with such care and dedication to our success. And hi to my mom and dad in New Brunswick.
Great presentation.
Thank you.
What else were you going to say?
Thank you. You are wonderful. Thank you, Isha. I just wanted to say, I was trying to say that I think Action 22 also applies to any of us in health and research, health and community research contexts. It's equally important there to be advocating for positive social change toward further legitimizing knowledge that comes from research methods outside of the kind of standard quantitative, qualitative binaries, and using that to kind of further push policy and decision makers to see that knowledge as a solid evidence for integrating Indigenous healing practices in mainstream health services and systems. Thank you.
Any other questions for Madison? Yep. I love the quote that you used about from research to death to researching ourselves to life, and I'm just wondering what that might look like to you in terms of putting that into action.
Yeah, so that was said by an individual, definitely not my quote, at the meeting, and I think really it's just Indigenous-led research, and community-based, so done by and for and with Indigenous communities, as guided by what Indigenous communities decide they need for their community to build capacity in certain things or to use current assets, just Indigenous-led. Yeah, and academics can be partners, helpers, facilitators, that kind of thing, but yeah.
That's great, thank you.
Thanks.
Hey, Madison.
Hi.
I'll just start by saying you had an amazing practicum with some amazing people.
Yes, I sure
yes,
did.
yes, indeed. One of the things you showed in the list of activities that you worked on was something like, what does that word mean? Sort of research, demystifying fact sheet or something.
Yeah.
Can you think of a couple of the words that you had to unpack for people? I'm really curious about what that list might have looked like.
Yeah, I kind of called it my jargon busting sheet, and it started even as simple as identifying researchers as kind of like co-learners in uncovering different truths versus science people coming to collect data. Researchers, methodology, Indigenous methodology, land-based methodologies, some acronyms that people kind of throw around pretty frequently, but community members might not know, that kind of stuff.
Awesome. Thank you, Madison.
Thank you.